All right, joining me now is a public health consultant, Dr. EKANEM. Dr. EKANEM, it's good to have you join me now. One would say, what a time to discuss or talk about World Health Day, or what a time to commemorate the World Health Day as the world is trying to grapple with the issues of the pandemic now, COVID-19. Talk to us basically how more challenging it is to look at the world, at the health sector in Nigeria now as it is.
Really, it's a very important time to talk about the health state of this country. Unfortunately, as it is right now, we are fighting one of the greatest pandemic the world has ever seen in this century. I really must say that Nigeria hasn't been prepared at all for times like this. If you look at our level of investment in healthcare, it has been quite bad. In 2015, the Abuja Declaration stated clearly that Nigeria, each African country, must invest at least 15% of the annual budget in healthcare delivery. And unfortunately, since 2015 till date, no time, there has not been any time that Nigeria has even committed up to 5%. And at times like this, you look back at the health system and then we wonder, can this present health system support a pandemic like this in our country? If you look at from the workforce that we have, just last year, over 2,621 doctors left this country. Countable number of nurses. I cannot even talk about the number of pharmacists that have left this country to North America and to UK. As I speak to you, we have grossly inadequate workforce to be able to walk us through this pandemic. And this is because these people have gone out for greener pastures because we couldn't pay them. Why couldn't we pay them? Because we have not allocated enough resources for healthcare. We are talking about even our facilities. If you go to some of our primary healthcare, they have all been converted to plantations. That is the situation of healthcare in this country. Some primary healthcare do not even have a single doctor to work. Nurses are medical directors. Laboratory scientists are medical directors. That is the kind of situation we have in our country. How then can we fight a pandemic like this? Ventilators are grossly inadequate at this time in this country that we need to fight a global pandemic like this. I think we have really over the years, we have really misplaced our priorities when it comes to healthcare. Health is the only asset that we have as a country. If we do not have health, we do not even have people that work and make the GDP that we need. We do not even have people that can lead this country. We don't have healthy citizens in this nation. Unfortunately, at this time, we are falling back to our moribund healthcare. Look at what happened during this pandemic. We had to go back and look at some of our laboratories that we can use for testing coronavirus. I am telling you that some of them were moribund. We had to revamp some of them, like the one in Abakaliki was revamped newly. The one in Port Harcourt is being worked on currently. These are things that we would have had on ground to be able to fight pandemic like this. And even beyond pandemic like this, we should have this health to cater for the health needs of Nigerians. Honestly speaking, the state of healthcare in this country is very poor. Away from even the pandemic, as I speak to you, Nigeria is the worst place to give birth in this country. I'm sorry to say that, but Bill Gates said that about a couple of years ago, that Nigeria is the worst place to give birth. Out of last year, out of the 303,000 women that died, during childbirth, 58,000 came from Nigeria. What are we saying? The indices are there to show. Nigeria still has the highest level of under 5 deaths in Africa. Why should this be so? A country that is one of the richest countries in the world in terms of our GDP. Honestly, we have misplaced our priorities. We have failed to invest in healthcare. We are talking about insurance. We are talking about insurance. Insurance is one of the things that we should have used to invest in our healthcare. I give you an example. We are about 200 million people. If we have 100 million people invest just 200 naira every month, How much are we talking about? We are talking about 200, I think about 20 billion naira. Now, if we do that for 1 year, we are talking about over 240 billion naira. That's enough to invest in a healthcare system. But unfortunately, we have invested so much money in HMOs, and the result is nothing to write home about.
Right.
I think at this time it is necessary for us to go back to the drawing board and really work on our health system so that in times like this, be able to have a healthcare system that we can fall back to in order to serve and protect the lives of Nigerians.
All right, Dr. EKANEM, let me leave you here for now. You said so much, and it draws our attention to how scary the situation is. But certainly, this discussion will continue after a while. Thank you so much for talking to us on TVC Breakfast. It's a great great Tuesday morning, rather. Thank you very much for joining me on TVC Breakfast. You can watch us online. We're streaming live on YouTube. You can also connect with us on Twitter using the hashtag TVC Breakfast. Let's bring you the updates at this time. It's World Health Day today, and the world is battling one of the worst pandemics it has ever seen. Here in Nigeria, events of the last few months have exposed the real state of Nigeria's health sector. Now, sudden donations and seeming fire brigade approach to building facilities attest to the neglect healthcare has suffered in years past. Now, Nigeria's health system will depend greatly on the lessons learned from this pandemic, and if it will be repositioned to perform to its optimum capacity. Joining us now is a public health consultant, Dr. Nsiabasi EKANEM, joining us on Skype. Dr. EKANEM, it's good to have you join us right now. In the past few weeks, we have seen donations of all kinds from well-meaning Nigerians, from institutions, from banks, to help shore up, the effort to curb or the spread of COVID-19. And we saw how isolation centers were built within 1 week, equipped, and all of that. Although it might not necessarily be comprehensive, but at least to help what the need for now. It tells that a great deal can be done if the will is on ground. Now, talk to us about where to start from, where we are right now. We've complained, we know what the challenges are, at least the past years we've been analyzing what the challenges of the health sector is. But today, commemorating World Health Day, where should we really start from as a country if we have to take that step?
I think as a country, the first thing we need to do is to place a ban on medical tourism. I will tell you that the reason why you see this vast development within the few days now is because some of our elites cannot travel out at this time. So they have to depend on what we have in country for survival in order to go through this period. I think that the way to go is for us to place a ban on medical tourism. If you need healthcare, you must get it in Nigeria. I believe that if we have everyone access healthcare from Nigeria and in Nigeria, honestly, we will all work together to make sure that we improve our health system. You could see what has happened within the past few weeks. It only shows you that, yes, we can invest in our healthcare. We can make our healthcare to be the best in the world. Right? Sometimes I read reports where I find out that some Nigerians have investment in abroad. Some Nigerians have some of the best hospitals abroad. Why wouldn't we bring it here? Because we know that each time we need healthcare, we can always fly abroad and access that. And that is why we do not take time to invest in building a formidable healthcare for our people. I think that the first thing we need to do as a country is to make sure that nobody accesses healthcare outside this country. I think with that, we will be able to, think inward. Now, that's one. Number two, like I said before, we need to strengthen our insurance scheme. Now, the Senate has pushed for a mandatory health insurance for all Nigerians. Of course, the NHIA case that was developed, in 2005, actually made a provision for people who are working for the government and people that are working for private organizations. Now the mandatory health insurance program would cater for everyone, both the formal and the informal sector. And I'm saying that if we can have a pool of funds, let's say that some Nigerians can, that can set aside a stipend, let's say about 200 naira, we can be able to, make a pool of funds that we can use to invest in our healthcare system. But again, the question is, when this money has been put together, how do we utilize this money? Would we have issues of corruption and financial misconduct with those funds? That again has to do with political will. When the Abuja Declaration was made in 2015, Nigeria was one of the signatories to this declaration, and I'm surprised that up until now nothing has been done. It was stated that every African country should allocate at least 15% of its annual budget to invest in healthcare. Unfortunately, that has not been done. I think that this COVID-19 era is a wake-up call for us to think inward, to know that we need to develop a healthcare system in order to cater for the health needs of all Nigerians. We are talking about universal health coverage, achieving that by 2030. How can we achieve that when we are not ready to make meaningful investment? Should we wait for times like this, a pandemic like this, for us to now hurriedly invest in healthcare? I saw the isolation center donated by GT Bank. It was wonderful. Some Nigerian companies, some individuals, some companies have come in and donated billions of naira. This could have been done even before now.
Right.
This could have been.
Let me interrupt you a little bit. As it is right now, you even said earlier on that when you consider the ratio of doctor to patients, we are short. There's a short in supply because a lot of them had gone for greener pastures in other parts of the world. Now, recently there was a letter that circulated even on social media coming from the Nigerian Medical Association, when they heard that some doctors were coming from China to assist in the fight against COVID-19. And in the letter that was written by NMA, it was rejected. They rejected the idea of Chinese doctors coming to Nigeria. Why is that, if you have an idea of what's going on?
Well, I think that at this point, as much as possible, we should utilize the workforce that we have in-house. I would say that, fine, while I appreciate the concerns of the Chinese doctors in coming to assist us, but again, we need to understand, first of all, what is happening in-house. We need to utilize the manpower that we have. Remember, this disease came from China. Honestly, in spite of the fact that China has Chinese doctors have really done great. We are seeing the decline in the number of cases, the decline in the mortality of COVID-19 in China. But I would say that we have doctors that can work. I will tell you this. Instead of us to even depend on doctors that are coming from abroad, I think we have manpower that can help us. Unfortunately, some of our doctors are not paid. We have some doctors who are not working as we speak. Some doctors are tellers, some doctors are working in banks because they are not employed. I think at this point, rather than invite doctors to come in, we should be able to engage those doctors that we have who are presently not working. I believe that we can be able to really go through this period with the workforce that we have. We should look inward. Some of our doctors who have, who are about to start residency, we can bring them in. Some of them are written primaries. They don't have any place to work. I think that this is the time for us to harvest all the manpower that we have and see ourselves through this period. I really do not subscribe to us bringing in foreign doctors at this time. For now, let us use what we have. If we actually run out of resources at the end of the day, fine, we may allow some other doctors to come in. But for now, since we do not know, honestly speaking, what we're dealing with, as a matter of fact, I think we should look inward first, and then when we have exhausted what we have in, where we can go outside. At this time, I wouldn't subscribe for us bringing doctors from China, please. I wouldn't.
All right. Thank you very much for your opinion, Dr. Nsiabasi EKANEM. Thank you for talking to us. We're glad to have you join us on TVC Breakfast this morning. Let's bring you the new updates now. It's World Health Day today, and the world is battling one of the worst pandemics it has ever seen. Here in Nigeria, events of the last few months have exposed the real state of Nigeria's health sector. Sudden donations and seeming fire brigade approach to building facilities attest to the neglect healthcare has suffered in years past. Nigeria's health system will depend greatly on the lessons learned from this pandemic and if it will be repositioned to perform to its optimum capacity. All right, now is a public health consultant, Dr. Nsiabasi EKANEM, joining us on Skype right now. Dr. EKANEM, good morning again. Thanks for having you join us. Now, I'd like to start with the issue of health insurance this time around as we talk about health, as we focus on health sector. Now, what would it take to have a health insurance for all health workers in Nigeria?
Health insurance is a very important scheme, and it's quite easy to achieve. With a pool of persons, workers in Nigeria, both within the formal and the informal sector, we can be able to pool resources together. If we tax them in terms of the money that is paid to them as salaries, we can be able to mop up some funds. For example, for workers in organized private sector and with the public sector, we can take a percentage of their salaries as their health insurance premium. And that can be summed up together to make a good amount of funds. For those in the informal sector, we can get them to contribute a certain amount of money at the end of every month. And this money serves as their insurance premium so that they can also access health insurance scheme. According to the mandatory health insurance scheme that the Senate is about to pass, it will ensure that everyone is captured, both those working with the public sector, with the organized sector, and those in the informal sector. Everyone can put aside certain amount of money, whether it's on monthly basis or quarterly basis, so that they can be able to access healthcare at no cost, to them, because of the premium that they have already been paying periodically. And everything summed up together can be used to invest in providing healthcare services to every Nigerian.
Dr. EKANEM, let me ask you this question before we leave. I remember you saying that you're not open to Chinese doctors coming in. Now, the Secretary to the Government of the Federation was trying to make clarifications by saying that it is a construction company that was bringing some of the doctors, about 18 of the Chinese doctors, as their corporate social responsibility. And some of the doctors are medical engineers, as the case may be. Would you still welcome or would you still reject the idea of them coming not on the bill of government, but as a company, a Chinese company in Nigeria, bringing them in as their CSR?
Well, here I think we should look more about the psychological effect of bringing these people. You know very well. We all know that this disease came from China. Now, just imagine you're talking, a patient opens his or her eyes and sees that a Chinese is the one attending to him or her. Look at the psychological effect that the patient will have. As I speak to you in this country, if you tell somebody that you travel to China or to any of these countries that is heavily burdened with this virus, I mean, you see the resentfulness, you see the stigma and all of that. I think at this point, the last set of persons we would love to have taking care of our patients are people from China or from the epicenters of this disease. I'm not looking about the amount that we are going to spend, whether it's the federal government that will spend it, but I'm looking at the fact that psychologically, patients would not be comfortable to see Chinese doctors treating this condition.
Yeah, Dr. EKANEM, at this time, shouldn't we spend time also letting Nigerians know that China, in as much as the COVID-19 came from China, as we all read on the news, they also have achieved great success in bringing the numbers down. Isn't that the success story we should be letting people know?
Very good. Until we are able to make that, this is about disease risk communication. Unless we are able to enlighten Nigerians sufficiently that, look, yes, this disease came from China, but Chinese doctors have done quite a lot. That as we speak, they have achieved a lot in containing this virus. Until we are able to achieve that, sir, I would say that it is only at that point that we can be sure that the Nigerian patient are psychologically stable to be attended to by Chinese doctor. But until we achieve that, then I will subscribe to it. But if we can achieve that and let Nigerians know that the Chinese doctors coming in are to consolidate on the efforts that Nigerian doctors have been putting in. For me, personally, I would say that, yes, Chinese doctors are going to bring in a lot of experts. They have achieved something great, something quite incredible in their country. Personally, on a personal basis, I would say that I welcome them personally. But I'm looking at the psychology of the patient until we are able to let Nigerians know that they are coming in for good and they have what it takes to be able to walk us out of this situation. Then that is only
all right. All right, thank you very much. So it boils down to the issue of communication here. Thank you so much, Dr. EKANEM, for your time on the program.